Welcome to the Dr. Francavilla Show. I'm your host, Dr. Francavilla, board-certified family physician and diplomate of the American Board of Obesity Medicine. I've been helping patients lose weight to treat and prevent medical problems for the last 10 years, and I'm taking what I've learned from them to you. In this podcast, you will learn the science behind why you struggle with your weight and what to do about it, tips for common challenges, work to fight bias about what a healthy weight really is, and improve your relationship with food and your body. Please remember that while I'm a doctor, I'm not your doctor. This podcast is meant to be informational in nature only, not medical advice. Please seek out care from your physician for your specific needs. Okay, let's get started. Hello, and welcome to this week's episode of the Dr. Francavilla Show. Today, I have a really exciting guest with us, Dr. Troutman, and we are going to talk about how the brain affects your ability to lose and maintain weight. So really excited to get all the details from her. So thank you so much for joining us, Dr. Troutman.
Well, thank you, Carolyn, for having me. I'm so excited to chat with you today.
So I'll give you a little introduction. So Dr. Caissa Troutman is the physician founder of reMDy, a direct care weight wellness practice. Prior to opening her own practice, she was the medical director of an integrated health system. Her professional training as an obesity medicine physician and a culinary medicine specialist helps her break down healthy eating and weight wellness to her patients. Dr. Troutman has a personal experience with obesity and has successfully maintained a weight loss of 32%. And as a result, she really understands the struggles her patients face. Her professional life usually follows her passions, and she's currently has a special interest in menopause health and brain health, which we are talking about today. And you can find her at weightremedy.net, and we'll get her information later and in the show notes. But welcome. Thanks for joining me today.
Hello. Hi. Thanks a lot for having me, Caroline.
All right. So today we're talking about the brain and how that affects our ability to lose weight. Tell us, what does the brain have to do with weight?
Yeah, so interesting. So I've always been fascinated with the brain. Side note, I actually wanted to be a neurologist. So I guess this is one of those like happy instances where I get to use my desire and apply it to like real life in my practice. So for the longest time, we always think about, oh, weight is just about being hungry, your stomach. One of the things I always ask my patients is, where do you find the struggle with weight? What organ do you think affects it? And, a lot of times they don't know the answer. And really what we know now is that obesity or the struggle with weight is most likely a disorder of the brain, right? I like to call the brain as that master regulator of our weight. It's actually what fuels our decision to eat, our body's ability to regulate weight. It's such an amazing kind of part of our body that helps or affects our weight journey.
I like how you called it like a part of our body, because I think sometimes we think of our brain as this kind of like mystical thing, right? Like we connect it a lot to our personality and our behavior, and we kind of don't think of it as a body part, right? But it is a body part, just like our pancreas or our stomach. And there's a lot of physiology, there's a lot of biology that's controlling that brain that is outside of what we can control, right? I can't control what my stomach is doing right now, right? And I can't control a lot of what my brain is doing either. And so I like how you kind of call it a body part, right? Like it's a body part, which means we don't have complete control over it.
Right. Yeah. And, one of the things when I first meet with my patient in the first visit, I always like to kind of give that background of what is weight, what factors kind of influence it. I talk frequently about the 4 pillars and how we manage weight, but part of that is looking at our weight with that 3-layer kind of concept, or the 3 layers or drivers of appetite, which is again master regulator of the weight, which I'd love to share with you and your viewers if you kind of
let's talk about it. So tell us about these 3 layers that you often talk about. Let's start with the first one. So what are these components of the brain that impact our weight?
Yeah, so I would like to kind of start by saying functional levels, right? So not like anatomical levels, but functional, how it functions, right? So the first function that I always like to think about is the first layer is that hypothalamus, which is the biological regulator. So this is the part of our brain which is actually, again, not in our direct control, and it's regulated by our hormones, which again, we can't control our hormones. We can't say ghrelin turn on as a background. We frequently talk about the hunger hormone ghrelin as a driver for hunger, and a satiety hormone like leptin to tell us that we're full. Those are signals that come from our gut that signals our brain to say whether we're hungry or not. So this is the part of the brain that receives that message and gives us that sensation that, yep, it's time to eat, or nope, I'm full, right? So that's the first layer. So it's kind of like when we're hungry, that's the first thing that our body or our brain goes to. And the second layer is that eating for pleasure, or that dopamine pathway.
Mm.
And I think we've all experienced that, right? Where we're literally like full. I just ate dinner, but that tres leches cake, which is actually my personal kind of struggle there, or a trigger, is like calling our name. So, and we, and that's when we want to eat it, even though we literally are full and stuffed. So,
I just got off a
right.
cruise, so I totally understand the dopamine reward part of the brain, right? You're like, I don't need a dessert, but that looks delicious and I'm going to have it, right?
It's funny. I just remember seeing this meme or video where it was a person at the entrance of the stomach, and he was letting people in. And then the stomach was full. So he said, oh, sorry, it's full. And then here comes a person dressed as a dessert, and then he let the dessert in. It's just so funny. That's the dopamine pathway activated, that it's like, I'm
Right,
eating,
right.
even though
Yeah,
I'm
you're
not.
full from
Yeah.
dinner. You're like, oh, I couldn't eat another bite. And then they bring out a piece of chocolate cake and you're like, oh, yeah, I got room
Right.
for that.
Right. Right. And that third layer is that prefrontal cortex. That is our thinking brain. That's our future thinking brain. And that's the level of the brain that when we want to lose weight, that's usually that desire to lose weight. That's where it starts. But of course, the biological regulator, the dopamine pathway, those are sometimes can be helpful or can be difficult, or barriers or obstacles when we want to actually proceed to lose weight. So the three layers are eating for hunger, eating for pleasure, and that prefrontal cortex or thinking brain. That's that functional level of the brain that either helps us or is an obstacle for our weight loss
Yeah.
efforts.
Tell me more about that first level, that biologic one, the hypothalamus, that physiologic hunger. Like, what does that feel like to someone? How can they tell if that's the layer of the brain that is, impacting their eating choices?
Yeah, the way I kind of explain it or show it, or kind of frame it, is that it is, like, number one, not in our direct control, right? So even if, and so often, and I know you've had your own journey too, but for the longest time when I would like try to lose weight and I would like not eat, and I'm sure a lot of patients can empathize with that, we would be like, oh, I'm not hungry. I'm just gonna drink water, right? So that our hunger hormone is high, but we're like trying to
We're
not
like
eat,
fighting
but
it. We're fighting that hunger.
yeah,
Yeah.
right. But in the end, again, it's not something, in the end, if you haven't really eaten, that's going to backfire and just drive that hunger. And now we're ravenous, and then
Yes.
we can't stop eating.
Yeah,
Right.
I often say like hunger is real, which sounds silly and sounds obvious to those of us who talk about this a lot. But I think that we get told that hunger is like a state of mind or it's willpower, and it's not, right? Sometimes I compare it to having to go pee. Like some people need to pee more often than other people. Some people's bladder, is bigger or smaller. Some people are more sensitive to it. Maybe they had some coffee. They really feel like they have to go, right? But like it's a real body sensation to have to go pee, and eventually you have to do it, right?
Right.
And same thing with hunger, right? Like it is a real bodily sensation. It is out of your control, and eventually you have to eat, right?
Yeah, I like how you phrase that. It's very organic. Yeah, it's like you said, it's a bodily function. Yeah.
And
Yeah.
it's there, it's programmed, right? And I often like to think, for most of human history, there was not enough food, right? And most of us now live in a world where we have an abundance of food, of calories available to us, but it wasn't like that. And so we are programmed to be more on the side of eating when available, right? To be hungry, to eat, because that protected us and made sure we always had enough nutrition. And in the modern world, sometimes that's not necessary, but we're still biologically programmed to be hungry and to eat. And so, yeah, I think recognizing that it really is a real bodily signal.
Right. Absolutely. Absolutely. And I think when we recognize that, that's also how we strategize treatment, right? As part of that four pillar foundation where we talk about nutrition. This is why it's important to have your fiber. This is why it's important to have your protein. This is why it's important to have your healthy fat, that well-rounded approach, because that is what's going to help that signal to that biological regulator be quiet, so to speak, right?
Right.
Yeah.
We have
Be
to make ourselves not hungry, right? To some degree. We can't just fight it. And that's one of the most common things I see my patients do is they'll come in and they don't eat breakfast, they don't really eat lunch, and then they have a tendency to just really overeat later in the day because they've kind of fought or suppressed that hunger for so long. And then when they finally, do eat or finally recognize that hunger, then it's like game over, right? It's like really hard to control it. So I think what I heard from you is like one of the strategies is to eat balanced meals so that we don't get sort of overly hungry. We want to make sure we're getting protein and healthy fats in so that our body knows it's okay, like it's not starving and that it doesn't have to keep giving us these hungry signals.
Yep, exactly. So when I kind of lay out this like three layers of that, three drivers of appetite, it's in a way a foundation of sorts. And I like foundations because we can always go back to it, whether it's our strategy moving forward. Okay, let's address the hunger. What can we do to make sure we're not hungry all the time? Well-rounded approach, hitting our protein, etc. Same thing if we're struggling, if we're not seeing the result that we want, then we kind of like turn the lever, turn the dial and see, okay, well, maybe moving forward, let's make sure this is happening. This part is being checked, that sort of thing.
So knowing these sort of three levels of appetite, what are some of the strategies that you suggest for your patient?
For sure. So many. So let's see. So again, for that first layer of that, which is the biological regulator, we kind of talked about it, right? I always frame it to, it's like the 3-4 approach, right? The three layers of the brain along with that four pillar foundation.
For those maybe who haven't listened like all the time, so our
Yeah.
four pillars are we utilize nutrition, we utilize exercise, medications, and like behavior, right? Are sort of like our
Behavior
four
change.
treatment strategies that we can use. And so for that hunger, obviously having like balanced meals, it sounds like for nutrition,
Right.
exercise. How does exercise play into that hunger? What would you say?
So exercise for me affects mostly the insulin resistance in a
Mm,
way. So a different hormone, not necessarily the
yeah,
ghrelin per se. So, there's some data, right, that if we even taking like a small short walk after a meal will lower the insulin resistance. So it's not always the hunger, but other
right.
hormones
But then that
in a
insulin
way. Yeah.
plays into like our appetite and our hunger. Yeah.
Absolutely.
I would say
Right.
another thing with
Absolutely.
exercise too is like sometimes you have to know this for yourself, but sometimes certain types of exercising or the timing of exercise can affect hunger. I'm definitely someone who gets way hungrier when I exercise more. And so I have to be intentional to make sure I eat before after I exercise. Otherwise, I'm going to be like crazy hungry, right? So I have to be really intentional. And so a lot of my patients, that may mean having a protein shake like right after they work out so that then they can have their next regular meal without feeling completely ravenous. So sometimes it's like, if the exercise is affecting your hunger in some way, like how do you troubleshoot that?
Honestly, in that pre and post workout, I haven't really dove into that just yet. So you have your patients hit a
I
certain
mean, it
like
just depends on the patient, right? But some people
right,
know that they get very hungry from working out. And
right.
so then that makes sense. Your body's trying to get those
Of
calories
course.
back, right? Your
Yeah.
body's always trying to stay in that
Right. Right.
equilibrium. And so for those people who know that exercise makes them hungry, like we plan for that, right? So if you do your workout and then you are really hungry afterwards, well, let's get ahead of that, right? Let's get you a protein
Yeah.
shake or, a balanced little meal so that you are not ravenous and making the wrong choices, right? Like let's just plan to eat something at that time instead of fighting that hunger.
Right. Yeah. 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 So yeah, so physical activity. So just as a backdrop again, when I think about the biological regulator, it's not just hunger hormone. I actually kind of focus on the four hormones. That will be your ghrelin, which is the hunger hormone, leptin, which is the satiety hormone, insulin, and actually cortisol. So
Mm.
those are the four kind of hormones I talk about a lot. And then again, utilizing that four pillar approach for each in a way.
And then
Yep.
for some
Yeah.
people
So
who
for
are just always
example,
hungry, like that may be also a role in medication, right? Like if you're just truly, truly hungry, even when you do eat balanced meals, then that may be where we need to like add that pillar of medication in.
Absolutely. Right. So again, this is where we recognize that it's a medical condition and it's not just about willpower and such. But yes, medications, the anti-obesity medications definitely serve as a tool. So it's not as hard for the patients to continue the lifestyle changes that we talk about. The other thing too, especially when it comes to cortisol and insulin, is stress and sleep. You
Mm.
know, we know that there's such a huge tie-in when we're not sleeping well. Ghrelin goes up, leptin resistance goes up. So that's another way. It's like if patients struggle with hunger and then I find out like, well, I've only been sleeping 5 hours and so that's one of the things like, okay, well, that is probably what is our current obstacle barrier. So let's talk about some strategies that will help your stress relief, stress and or sleep.
So even though we
Yeah.
can't control our hormones, there's things we can do, right?
I,
So we
yeah.
can,
Yeah.
work to reduce stress. We can get enough sleep. We can nourish our bodies. We can pay attention to those hormone signals that we can feel for hunger and see what we can do to solve them. So I think sometimes when we say like, oh, it's biology, it can feel helpless, but that's not necessarily the case. We just have to understand the biology in order to use it in our favor.
Absolutely. You're absolutely right. Part of why I kind of take the time to, and I'm sure you do, to like explain the physiology and biology of obesity to my patients is to destigmatize it, right? It's like kind of like
Yeah.
any other medical condition like hypertension or blood pressure. We start that by understanding why it happens, not to say, oh, it's your fault, but it's like, okay, this is kind of why it happens. So let's kind of figure out what we can do, because absolutely it's not a foregone conclusion that that's it. It actually, I find it's very empowering for patients when I explain to them that this is why it's hard, number one. And I don't know about you, but I frequently have had people cry at the first
Oh
visit with
yeah,
me.
yeah. I mean, to finally
Yeah,
be listened to and understood and to realize it's not your fault, right? Because so many people get
yeah,
told over and over again it's their fault. And I think when we have science that explains why it's not someone's fault, that's really powerful. But it doesn't mean it's hopeless, right? Like there's things we can
exactly, right.
do, but understanding that it's not your fault and that just continuing to try to restrict what you're eating is not really the only solution.
Exactly, exactly. I think it's just a very powerful kind of
Absolutely.
opener and just, again, understanding of how things are. Absolutely.
So in that eating for pleasure category, so we talked about hunger.
Oh my
I
God.
think we've done a nice job kind of covering that layer of the brain.
Yeah.
So this eating for pleasure, right? Which can mean lots of different things. It can be dopamine. Sometimes it's like emotional eating, some of those sorts of things too, right? But when we talk about that, what are some of the most common solutions that you walk your patients through?
Yeah. So again, when it comes to that reward pathway, dopamine pathway, the way I kind of approach it is this is the pathway that makes decisions based on human need, also known
Mhm.
like what we call the motivational triad. Basically, what it is our brain, our default brain, will always be motivated to make a decision that follows three things. One, will avoid pain. Nobody wants to feel hurt. Will seek pleasure and be efficient or conserve energy. So that's what we call the motivational triad. So same thing, and this can apply to anything in life, including food, right? So we'll always be motivated to, at the end of the day, if it's been a rough day, just Netflix and chill. I mean, well, I shouldn't say Netflix, sit down and then just eat what's easy. Or I'm gonna raise my hand and say sometimes what I do is like, even though I have food planned, I'm just gonna go buy Chick-fil-A and because it's easier and it's yummy, right? So very
Yeah.
frequently those are the default settings, so to speak, of our human brain. Again, so same thing, even though that's the default, it doesn't mean that we don't do anything different. But it starts with recognizing this is why I do this, right?
Yeah,
And
like we're
I'm not
gonna avoid
unusual.
pain. We're gonna look for the thing that feels good, and our body's trying to be efficient. So, I mean, Chick-fil-A, I think, is a perfect example of that, right? Where you're like, it's efficient and it's got that reward, and like the pain of going home and making dinner is like can be pretty brutal sometimes,
Yeah.
right? So I think
Yeah.
that's a perfect
Yeah.
example of like, and then if you understand it, you're like, okay, well, what do I need to do differently, right? Like, do I need to have an easier dinner to make at home? Do I need to still go to Chick-fil-A but make better choices, right? Like, can I make,
Right.
some leaner choices? Can I skip the soda or skip the fries or something? Like, so recognizing it and not just throwing your hands up, but like, how can I, operate within this brain that's always going to try to find the easy way out.
Right. Exactly. And then kind of recognizing too, like, okay, brain, this is why I'm doing this because I'm stressed, probably, right? There's usually a reason why I want to do this particular decision. So kind of just pausing and recognizing, okay, it's okay that this is happening. And like you said, find a different kind of path.
Yeah.
So when
I
we
have a
recognize
quick.
that this is my default, one of the tools to answer your question is like doing pre-decisions
Yeah.
or kind of ahead of time. And I know you've talked about that as well before,
But yeah, tell
so
us what you
that
mean by
is,
that. Like, what's an example of like a pre-decision?
yeah. So for example, if I have patients that tell me that would say, I always have no time to prep my meals, so I always eat out. So simple, actually pre-decision is I ask them, do you have a fridge in your office? I like, yeah. So, hey, can you put in there some of the foods that are easy to make so that you don't have to like stress out and going out to buy lunch, you know? So that's just one example.
But it's that kind of making it like, you always fall into that same trap. What can you do to make your life easier so you don't fall into that same trap again, right? Like, like
Right.
you, maybe even with exercise, it's, well, by the time I get all my clothes together, it's so much time. But okay, well, what if you just wore workout clothes to begin with, right? Or, like what are some of those simple things so that you're not having to make decisions or do things later? Because once we're tired, once we're hungry, it's really hard to make the
To
choice.
make
But if we make
decisions.
it a day or two before, then
Yeah.
it becomes easier.
Exactly. And then this is where again that the third layer, which is that prefrontal cortex, that thinking brain, we want to make those pre-decisions when we're
Yeah.
using that prefrontal cortex. Because like you said, when we're in the midst of stress, overwhelm, what have you, we default to that automatic reward pathway,
Yeah. And so sometimes that's
right?
as easy as like committing a little bit beforehand, right? So, I
Right.
think for that dopamine, that reward pathway, a lot of times eating at a restaurant is like a trigger, right? Because once you get to the restaurant, they are number one, they're usually advertising exciting things to you, right? There's a picture on the table of, a cool appetizer or a dessert.
Yeah.
Your friend is, oh, I'm gonna get this. Like you're hungry, you're excited. And if you have already looked at the menu like the day
Ahead of
before
time.
or at lunch or when you're not that hungry and you can think a little rationally about it and be like, okay, like I know I'm going to want the molten lava cake, but like, I am going to pick, this salad and I'm going to already have decided that I had dessert yesterday. Maybe I'm not having a dessert today. And you go in with that plan. Now, sometimes plans go out the window, right? But if you don't have a
Exactly.
plan at
Yep.
all, like you're going to go to the restaurant and you're going to order like mozzarella sticks and a cheeseburger and dessert and a soda and like really not be on track with your nutrition
Right.
choices. But if you've already decided like I'm going to stick with water, I'm going to make sure I get something with vegetables, then you're making better choices and you don't have to decide in the moment.
Right. You're honoring that. I always like to talk about the future you and the current you, right? You're honoring that future you as well.
Yeah,
I
I
mean, the
like
one
that.
thing too, yeah, yeah. One of the things I also talk about with my patients is that habit stacking. Have you
Oh
used that
yes,
or
yes, I love habit
yeah,
stacking.
right?
Yeah, but tell us about it.
Yeah. So like that with the exercise that we were just talking about, okay, the cue is when you get in your house, take off your shoes, we're gonna put on our workout clothes, and that's your cue to work out.
Yeah.
So, and then it becomes a habit. So that way, even though it's like, oh my God, I don't want to work out, it's like a habit that when they put that workout clothes on, they do it.
Like water is one of my like habit stacking things where I fill up my water at the beginning of the day and I make sure I finish my water before lunch, right? So lunch is my cue, is my water done, right? And then the end of my workday is my next cue, is my next glass of water done, right? And so that is like how I just make it automatic. So I don't have to remember to drink water. All I have to
Right.
remember is, if it's not finished by this time, I got to finish it. So those little tricks where you kind of like put things together so you don't have to remember to do everything you need to do.
Right. That's a predecision. Oh, it's so funny with the water. Mine, and I always share this with my patient, is it's water before my coffee. So I go down when I wake up and I turn on my Keurig and that's my cue. Okay. I turn Keurig, get my water, get my coffee.
Yeah. So that's another great example, right? So it's just looking for those things. What do you automatically do, right? Like, do you brush your teeth every day? I hope you do. Do you brush them twice a day, right? Can you pair that with something else, right? Like, is that when you'll
Right.
remember to take your medicine? Is that remember when you'll remember to drink a glass of water? Like, how can you use the things you're already doing that you have good habits for to create new habits?
And part of that, circling back to the original question of dopamine pathway, and this is also helpful in identifying your triggers, what are common obstacles, triggers, and then from there, thinking of like, okay, well, how can I rewire the brain for that way, So
Yeah, yeah. And the first is just recognizing it, right? So if we just go through
yeah,
our life just not understanding these things, then it's really hard to make change. So, well, let's kind of review. So you kind of talked about there's these three levels of the brain. So one is this like this hunger, this hormone level, these biologic regulations. And so those are kind of out of our control, but we can use lots of strategies to minimize them. There's
right,
all these like pleasure, dopamine, reward pathways that also
yeah.
kind of make us eat. And we can use our third layer of our brain, our thinking brain, to plan out and minimize the effects of those things we have less control over.
And be mindful. I think that prefrontal, like that's that mindfulness, which you just shared earlier, like awareness, similar word, right? Awareness, mindfulness,
Yeah,
pausing to recognize what's going on. Because if we don't and we just go through life on automatic, we can't change if we don't know what's going on.
I love it. We can't change if we don't know what's going on. It's so true,
Yeah.
right? And if you're struggling to figure that out for yourself, that's where an obesity expert or a dietitian or a personal trainer or someone else with that outside viewpoint can sometimes help you figure that out and figure out what you can do to sort of hack your biology and hack your
Right.
behavior so that you can get those results if you haven't been able to figure out how this is all working on your own.
Right. Yeah, for sure. For sure. Yeah. And then that third layer, like I said, like you shared, it's like all of that helps with hacks for both all that. And I did want to mention it, and I don't think I mentioned it yet. I think for all of this, what is important is also just kind of mindset, you know, like coming into this, knowing that you have agency over a lot of things and old history, or, what when I say old history, failures, quote unquote, right? Where it didn't work, doesn't have to follow you with this particular journey. You know?
I love it. Like, yeah,
So I
these
think
things are
yeah,
changeable.
absolutely. Yeah. 'Cause that's how we evolve, right? I mean, if I look at my past failures of up and down weight loss, weight gain, then you know, do I just give up? No. So I think for anybody that's listening, right, your past doesn't define you, right?
I love it.
You
I
you
love
have
it.
control over now and future. So
I love it.
yeah.
Well, any final thoughts? I think that was a beautiful one to wrap up with.
Oh, so many, but okay. So I think I always back to like obesity is a medical condition, right? It is not just about willpower. It's not about powering through. It is a complex relationship of so many things, like genetics, environment, emotional dysregulation. So hopefully sharing that four pillar path with that three layer approach kind of gives us that overall kind of picture and hopefully strategy in kind of moving forward. And like you shared, if they need help with figuring things out. Sometimes an outside person that can evaluate it is very important. So, reach out to an obesity specialist or other healthcare professionals that will be helpful.
Well, thank you so much for joining us today, Dr. Troutman. If listeners want to find or connect with you, where can they find you?
Yeah, so I have a brick and mortar practice in central Pennsylvania. And my practice name is reMDy, REMDY, and it's on www.weightremedy.net. But I also see patients via telemedicine as long as they are in Pennsylvania. Yeah, thanks for having me. So much fun chatting over our similarities and our stories.
All right, awesome. Thank you so much. And until next week, take care.
Thank you for listening to the Dr. Francavilla Show, where we learn about all things related to weight and health. If you love this podcast, make sure to leave those 5-star reviews and share this podcast with a friend or loved one. If you have a topic about weight and health you want me to tackle, head over to the website, thedrfrancavillashow.com, to submit your question. And make sure to subscribe to the podcast so you don't miss next week's episode. Take care.